next presenter will be Harry with Maryville Pharmacy. Harry, are you available to present?
I am. Thank you for the opportunity.
Give me just one moment here, and I will navigate to your slides. And we can begin whenever
Sure.
you're ready, sir.
So my name is Harry. I am from Maryville Pharmacy, right in the middle of Madison County with Maryville, Illinois. We're located right off of 159 Catacorner to Bobby's Custard, which I know quite a few of us are very familiar with. And next slide. As far as who we are as a pharmacy, we're an independent and family-owned pharmacy. Not necessarily a Walgreens, a Walmart, or the major retail out there. It is a single store, family-oriented, family-focused kind of environment in which we do our best to take care of patients walking in the door from all walks of life. We serve a lot of patients in a traditional way in which we do traditional pharmacy. So a prescription comes in the door, we analyze and fill it based on different clinical and regulatory references, and then we dispense that to the patient. But it's more than just a lick, stick, pour kind of method, because we also have a lot of specialty services that we offer as a pharmacy. We do compounded personalized medication. So instead of someone writing for a Z-Pack and then we fill a Z-Pack and that's it, if someone has particular allergies or if they need a customized dose, we have the ability to take the active ingredient itself and tailor it specifically to what a patient would need. Whether it's human, dog, cat, we serve them all. We also do medication planning services. We use blister cards and planners to be able to help organize medications for patients to make it a little bit easier for them to take during the day. And that way that helps increase their adherence and overall health outcomes. We also help with planning in what we call MedSync, or medication synchronization. So that way we can try to line up the fills of all their medications to be filled on a single day per month. So that way it makes it easier for people to come in, and especially during these times with COVID, you don't necessarily want to be out that often. We also provide durable medical equipment, so wheelchairs, walkers, rollators, and compressions garments, various kinds of aids like for toilet seat risers, for sock aids, and many different items out on the shelf, or something that we can order usually a next day. And we try to train all of our staff on the different uses and different applications of all those products. We also have a member of our staff who specializes in fitting for those who undergo a mastectomy, and be able to fit them for prosthetics or bras or something to help with the symmetry and help a person have a better esteem after going through that process. We also offer so many different other kinds of services, let alone our delivery radius as a pharmacy compared to many of the major retails in our area. So there's a lot that we have as a pharmacy that we can offer our patients. And we are looking for someone who can help us in that pursuit to be able to serve our community. As far as the business itself, a lot of people are familiar with our previous owner, Gary Soretto. He established the pharmacy back in 1976. We had a transition in ownership to our family back in October of 19, and we chose the perfect time to switch over because that was right when the pandemic happened. So we have been doing our best to do what we can to improve the kind of service offerings that we have, as well as what we have inside the store. And there's been a lot of development as a new company within an old company, and there is so much promise and potential that we want to bring to our community as we move forward into the future. Into the next slide. The primary job that we're looking for is a pharmacy technician. It is fairly defined by Illinois law as far as what those requirements have to be. And so that is our mandatory requirements for what we're looking for in our workforce. We're looking for someone with at least a high school diploma or equivalent, and someone who has no history of illicit or prescription drug related crimes in their history. We also would like to have at least 1 to 2 years of retail or healthcare experience. So someone who works as a nurse or someone who works in checking up people. Those experiences tend to lend well into a community pharmacy realm, strictly because there's a major retail component there. We are also looking for someone who can be very helpful with expanding our communication profile. Yo puedo hablar español y busco para alguien que puede hablar español también, pero if you don't, that's not a problem. So it would be also preferred to have someone who is certified, and that means that you've had at least 2 years of experience in a pharmacy, or were able to pass the certification test required to become a certified technician. We're also looking for someone who has that experience as well, and we're looking to pay based on that experience alone. So there's a lot that we have to offer as far as teaching. We have a lot that we can kind of fit someone based on their preferences as far as what we have to serve for our patients. I don't have this on the slide, but I also potentially am looking for someone who is a delivery person. They will still need to be licensed as a pharmacy technician. And if you are not licensed as a pharmacy technician now, we will help you get that licensure. One way or another, whether it's for the technician position or even for a delivery position. We're mainly trying to fill out our team to make sure that we're as adequately prepared as we're moving into the next step of our business. The pharmacy technician position will be a full-time. The delivery person will be part-time. Moving to the next slide. As far as the perks, we're pretty much looking for a full-time day job, 9 to 5 or 9 to 4, whatever your preferences would be, for a full-time Monday through Friday kind of job. We're looking for someone in the morning. There is no need to work any weekends. We have paid major holidays. After a probationary period for our full-time staff, we have health and supplemental insurance. We also do a 401k match. And there's many different areas of specialty, whether you want to focus on compounding, the durable medical equipment, or the long-term care. There are many different ways that you can assist us as we move forward. And there's also various perks that kind of come up throughout that we as an ownership want to do to take care of our family with a PH. Solely because if you take care of us, we will do our best to take care of you. And we want to make sure that it is mutually respectful and mutually beneficial for both parties. I have a very short presentation, but mainly what I'm looking for are staff members who are engaging, who are very retail patient focused, and who really look to the opportunities of a kind of building business as we move into the future. So I have my contact information on the screen. You can reach me at info@Maryville Pharmacy. You can give us a call, just dial option 3 as soon as you hear the music, or you can even stop by. I think Bobby's is closed, so you can't get any custard right now, but you can stop by, maybe go to the coffee box and get some coffee, and then come on by, and then pick up an application. As far as the timeline goes, once you drop off or send in an application with your resume, we'll review it over the next couple of days. If we're interested in your application, I will personally reach out and do a phone interview, which is just a brief 15, 20 minute just to kind of review your history and various kinds of things that I personally look for in a staff member. And then after I present that to the rest of the ownership, we set up an on-site meeting to be able to talk that over between myself, my sister Catherine, who's the pharmacy manager, and then also get to introduce you to kind of a brief tour of the pharmacy and the other staff members that we have. And then if we're interested in your employment, we'll get you on board and kind of get you all the necessary paperwork behind it. And in either case, if we decide to move to a different direction, we have your application on file, and we'll always be able to reach out to you if you're still interested in the position. Beyond that, we're really accessible. Unfortunately, this isn't a job that we can do remotely. This is something that a lot of our patients respect, for having our lobby open and having a person to meet and talk to and face to be able to kind of deal with whatever health issues they may be going through. And so you're always welcome to stop on by, meet us, have any questions, talk with us, whatever it may be. So that's my spiel. If you have any questions, definitely reach out. Thank you for the opportunity.
Thank you so much for that presentation, Harry. If anyone has any questions for Harry regarding employment at Maryville Pharmacy, you can enter those questions into the chat and we'll get them answered for you during the Q&A session that will be taking place now.